Hi, my name is Joe, and I'm joined with Katie, Hoy, Eric, and AJ,
Hi.
and we'll be discussing medical and recreational marijuana and its effects on humans and animals.
Yeah.
Marijuana defined. Marijuana refers to the dry leaves, flowers, stems, and seeds from the cannabis sativa or cannabis indica plant.
So, since our topic is about the effect of marijuana on humans and animals, I figured that we should start back as to why marijuana is illegal in the first place. Ever since 1937, the use and sale of recreational marijuana has been illegal in the United States of America. But why was it deemed illegal in the first place? People all over the world had been using cannabis for over 5,000 years and never had been made illegal before. In America, nobody had any real issues with the drug before, and a lot of people had household drugs with cannabis as the active ingredient. So if this drug was not harming anyone and has medicinal properties, why make it illegal? The answer is racism against Mexicans coming to America after the Mexican Revolution starting in the early 1900s. This is all thanks to a man named Harry J. Anslinger, who oversaw the Department of Prohibition. Marijuana has been used worldwide for as long as history dates back. The first accounts of cannabis being used dates to 1500 BC when it was used in Chinese medicine. Not only has the drug been used for as long as written history, many famous historical figures grew and used marijuana. George Washington, for example, has agricultural ledgers of growing hemp. If this has not been an issue for as far back as written history dates, then why suddenly has it been made illegal in the United States? People all around America had medicine containing cannabis as an active ingredient in their kitchens, like I said before, and there was no legal issues beforehand except for the sale to minors. And even Harry J. Anslinger said there was not much wrong with cannabis before he made it illegal. After the prohibition on alcohol had failed in the United States, Anslinger realized that he needed to do something with his department or else it would get shut down. Anslinger realized that he had already said that there was nothing wrong with marijuana, so he needed a way to convince people that it was bad. He resorted to racism, and it worked. In the early 1900s, there was a large influx of Mexicans after the Mexican Revolution ended. Because they needed money to live, they went working for jobs and took some from U.S. citizens, which built up a resentment for Mexican people in the U.S. Anslinger used that anger and villainized cannabis because the Mexican people used the drugs as a relaxant after a hard day's work. Anslinger used the Mexican word for cannabis, marijuana, to assign the drug to the Mexican people even more. People around the United States knew what the word cannabis meant, but Anslinger gave it another name. People could view it differently.
The way marijuana works to help both humans and animals starts with receptors in the brain. Cannabinoids bind to receptors called CB1 and CB2 in the body. Most people know about THC, which is the main psychoactive ingredient in marijuana, which gets a person high. CBD is the ingredient responsible for marijuana's healing effects.
Marijuana, once used as a recreational drug, has become more popular for its medical uses. It has been acknowledged that marijuana provides many advantages once consumed. Marijuana has become more legalized across the United States, giving a broad attention to the psychological benefits. Many people have experienced a sense of euphoria, better night's sleep, easing of pain, and relaxation of the mind. This gives the human psyche a profound benefit. Contrary to popular belief that smoking marijuana causes cancer, marijuana has been used in studies to help cancer patients. A large study reviewing the medical records of 64,000 men in the United States found that the use of cannabis was not associated with tobacco-related cancers. In the United States, medication containing marijuana has been used to help stimulate appetite in AIDS patients. In other countries, an oral spray has been approved for the treatment of multiple sclerosis, multiple spasticity, and cancer-related pains. Marijuana can help relieve many medical symptoms. It is legal on a federal level in the United States. Early research shows cannabidiol and its derivatives hold potential promises in additional conditions like drug-resistant epilepsy and some psychiatric disorder, anxiety, substance use disorders, schizophrenia, and psychosis. Medical marijuana uses are becoming important on understanding its will's behavioral effects. Vanderbilt University researchers have found cannabinoid receptors through which marijuana exerts its effect, and a key emotional hub in the brain involved in regulating anxiety and the flight or fight response. Researchers has become profound on the study of psychological benefits of marijuana. The more studies that are done, more benefits will be recognized. I'm here today with Dr. Raymond Elias of Alternative Medicines. How are you doing today, doctor?
I'm doing great. How are you?
I'm doing great. I'd like to ask you a couple questions for my school project
Okay.
on medical marijuana and how it helps the brain.
Mm-hmm.
My first question is, of course, how does marijuana help the human brain?
Well, to start off, there's a thing inside of marijuana called cannabis. And pretty much cannabis is one of the things that are, in recent studies, a lot more helpful than it used to be back in the day. When they first started doing research on marijuana back in like 1970s, what they had done is they strapped a gas mask onto a monkey and they pumped hundreds of joints worth of smoke into them. This was when research first started, and pretty much this is where the whole revolution of pretty much bad marijuana effects came from, because the monkey suffered from lack of oxygen and lost a lot of brain cells.
Okay.
But in recent research, back in about like 2005 at the University of Saskatchewan, they showed that cannabinoids cause neurogenesis, which means that they help make your brain cells grow and you can develop more brain cells, because pretty much it has this thing inside of marijuana called neurogenesis. And pretty much like other drugs do not have these kind of effects, but pretty much whenever you go and you take in medical marijuana, it promotes neurogenesis, and neurogenesis is what helps your brain cells grow. And it promotes new brain cells, and it helps your brain stay a lot more active than it is now.
So, doctor, you're saying that cannabis helps with the psychological benefits?
Yes, it actually precisely helps with psychological benefits with medical marijuana. Pretty much researchers found that THC protected brain cells and preserved cognitive function over time, and they also suggested that it could be preventively for ongoing protection. And pretty much this last study, I'm kind of thinking here, this last study that my team ended up doing is actually quite remarkable, and to be honest, in my opinion, I believe it should have made headline news. Researchers analyzed that blood samples from hundreds of people who had suffered head injuries, and pretty much the people that they found with small amounts of cannabinoids in their bloodstream who suffered these head injuries were 80% less likely to be killed from head trauma. So that's something that's actually really good when it comes to marijuana. And pretty much this means that, in a group of occasional pot smokers and a group of abstainers who suffer similar brain injuries, the pot smokers will only have 2 deaths for every 10 suffered by the actual abstainers. So that means that when you're going and you're taking in cannabis and you have a lot of cannabinoids in your body, it pretty much protects you from serious head injuries when it comes to trauma, and as well, Alzheimer's and all those things.
So, doctor, are there any other benefits of medical marijuana, such as how does it help cancer patients?
Pretty much, there actually is something that really helps with this. It's pretty much brain cancer. And this is really exciting because cannabis, or cannabinoids, is the treatment of cancer. And in recent research, 2012 study actually, CBD stopped metastasis in aggressive forms of cancer. So when you're going and you're a cancer patient and you're taking in marijuana, what it's doing is it is killing the bad brain cells, the leukemia cells that are inside of your brain. So pretty much THC and CBD can be combined with traditional chemotherapy, and it can produce dramatic reductions in brain tumor size. So when you're taking in medical marijuana and it's going through your system, it is going and killing off all of the bad brain tumor cells. It's going in just giving reduction in brain tumor size, and as well, it's nothing new. It's what's been used ever since 1998, and pretty much it kills glioma cells, so which is like an aggressive form of brain cancer. So it's used to pretty much kill cancer cells while it does not affect normal cells. So that's also another safety thing that would be pretty good for marijuana.
Doctor, well, thank you for, thank you. I just have to say thank you, and I appreciate your
No
time.
problem.
And you have a great day.
You
Thank
too. Thank you.
Marijuana affects the entire human body system, both beneficially and harmfully, depending on the time you use it, the frequency you use it, and the amount you consume. According to what HA said, there are many ways you can consume marijuana. You can either smoking it, or eating it, even put it in hot water to use as tea. So you can put it in brownie, cookie, or candy. So that's why they say that don't eat the brownie that people hand you out at the concert. When people smoke marijuana, the THC will pass through their lungs to the bloodstream and affect the body immediately. Although the effect will wear off much faster than eating it, the THC effects from food and beverages are delayed because it must go through the digestive system. Therefore, the effect will also linger longer. Since smoking is a way to consume marijuana, its effect, the respiratory since smoking is a way to consume marijuana, it affects the respiratory system similar to smoking tobaccos. Toxic chemicals will increase coughing, mucus production, and the risk of lung infections. In the other hand, there are no evidence that smoking marijuana will cause lung cancer. The THC from the respiratory system, we move to the circulatory system to the lungs. The circulatory system is like your bloodstream, your blood veins, and your heart. It makes smoker heartbeat increase rapidly up to 150 beats per minute. And therefore, the risk of heart attack will also raise. The next system in your body will be affected if the digestive system. The THC can cause nausea and vomiting. However, the extract of it can reduce the system. However, its extract can reduce the symptom of nausea, and ultimately, the central nervous system will also be affected. And this leads to the psychological effects, which Eric will talk about later. THC makes the brain produce a huge amount of dopamine, makes the users high, altering senses, changing mood, having difficulty of thinking and problem solving, impair memories. With a higher dose, it can also cause hallucinations, delusions, and psychosis. Since marijuana affects the central nervous system, medical marijuana can consider to ease pain and inflammation. There are many studies show that medical benefit of marijuana. I know that I just tell you a long list of how harmful it is, but with a reasonable and controllable dose, marijuana can be used as a really good medicine.
Marijuana in the medicinal form is not just used for humans. Pet owners are giving it to their pets. It's a good way to help pets with pain and illness. Dr. Amanda Ryman talks about the effects she's seen personally on her pets in an article on PETA's website. She says that her 11-year-old cat was diagnosed with intestinal cancer and the tumor was inoperable. Ryman mixed in a little cannabis oil with her cat's food and immediately noticed the difference. While the cat had previously not been sleeping and eating, she started acting like a kitten, slept, and ate. Using marijuana for animals dates back to the time of ancient Greeks when marijuana was used for horses in a treatment called Berlin Hippiotrica. Herbs, including marijuana, were mixed and put on the horse's wounds. Now there's a treatment created by Brian Walker and Ed Breslin to help inflammation problems in horses. It's partially made of a non-psychoactive form of the chemical THC, which is found in marijuana. The anatomical structures of animals and humans are different. Despite that, there's evidence that the effects of medical marijuana on humans and animals are similar. In an interview with Gary Richter, DMV, he says that the endocannabinoid system in dogs and cats acts the same way it does for a human and therefore can be used in the same way. The endocannabinoid system is where the brain and immune system produce cannabinoids. The biggest difference between dogs and other animals is that dogs have more cannabinoid receptors in their brain. This presents a problem because this makes a dog more susceptible to overdose. It can also be used to treat many of the same things in humans and animals, like arthritis, chronic pain, and nausea. Pet owners may be worried about administering a drug to their pets that's difficult or even dangerous. It can also be used to treat many of the same things in humans and animals, like arthritis, chronic pain, and nausea. Pet owners may be worried that administering the drug to their pets is difficult or even dangerous. There are some topical treatments, but cannabis oil is the main form of medicinal marijuana that's given to animals. In an interview with Gary Richter, he says, if you dose pets properly, then they are going to get the positive effect that you're looking for while not having any of the psychoactive side effects. The key to keeping pets safe when it comes to medical marijuana is dosage.